Hi, my name is Dr. Tom McAbobby, and I'm the Program Director here at the St. Elizabeth Boardman Family Medicine Residency Program. I'd like to welcome you here today to take a look around at our program and see what we have to offer. We find that residents come here to our program for not only exceptional teaching opportunities, but also great clinical opportunities as well. You'll find that you can meet all of your academic desires and needs here at our program. Residents choose to come to our program in order to better themselves as fully functional family physicians. Our goal is to graduate a resident who is pluripotential, capable of going into any kind of clinical teaching environment, whether you go into traditional family practice, outpatient-only medicine, inpatient-only, or go on to pursue a specialty. We're fully accredited by the ACGME Family Medicine Residency Program. We take 4 residents per class for a total of 12 residents within the program. Our residents spend a lot of time rotating through clinical environments in the inpatient and outpatient settings. In addition to rotations here at the St. Elizabeth Boardman Hospital, we also do some rotations at Akron Children's Mahoning Valley. So if you're looking for a career as a family physician and want an opportunity that will prepare you to be able to enter into any kind of clinical environment after your residency training, you want to keep us in mind. You'll find the combination of excellence in teaching and exceptional amount of clinical experiences all add together to give you the best opportunity to be a high-functioning family physician.
Hello, I'm Sumira Koirala, one of the core faculty members. Here in our residency program, we recognize that teaching is an intrinsic part of being a physician. The meaning of the word doctor in Latin is to teach. To teach is to learn twice. The ACGME recommends that the senior residents serve in supervisory roles during their training. It has been proven in studies that the residents who are more successful and are higher rated as teachers are better in knowledge acquisition, communication skills, and have higher patient care outcomes. So if you're looking for exceptional teaching and friendly environment, this is the right place for you.
A few things that I looked for when I was applying for programs was a program that allowed me to implement continuity of care and a culture of collegiality among the residents and the attendings. St. E's not only provides that, but also allows me to practice the medicine that I want to practice. Everyone is super nice and super welcoming, answering all my questions.
So it's a little bit of a smaller hospital, I guess you could say, but it gives me the opportunity to really interact with my own program. You know, the size is a factor for that, but I'm also able to interact really closely with a lot of different specialists, rotate with them, really get to know them, have their contact information really readily, and I just have this breadth of specialists that I can talk to at almost anytime. People are really receptive to that. They're used to us being here, used to us asking them questions, and we kind of have a good relationship with a lot of people that way. So I feel like I just have a ton of resources at my disposal.
I'm from Ontario, Canada, so I found that Youngstown, Boardman area is very similar, and that's something that was important to me, to have that small town feel, but also be able to do what I wanted to do. And then I think despite being a small town, Youngstown and Boardman have a lot to offer in terms of hiking and shopping and restaurants as well.
It really is kind of easy to see whenever you're in like a smaller city, bigger town, that people know each other and people come to expect certain relationships in a good way that they have with each other. You really do get a nice tight-knit community feel. I have a lot of patients who have been transferred to me from somebody else who've had these long-term relationships with physicians, and you kind of get a sense that you really are in a smaller town where you get to know your patients, you know where they're from, you kind of know their background once you get into this area, and it helps you to understand where your patient's coming from, and also just feel closer to them, feel like, this could be my family member, this could be my neighbor from whenever I was growing up, and you kind of identify with them in a way because it's just easy to kind of understand what this area is about.
Residents find that living in the Youngstown area has given them not only opportunities for professional growth and development, but also for personal growth and development. All in all, our residents are able to pursue their clinical interests through several elective rotations, and also our residents find that our family medicine inpatient service yields high volume and high intensity teaching opportunities. In short, our residents are able to find everything they need within our program.